Erectile dysfunction at 20. When people think of ED, they generally think of elderly men who are out of shape, unhealthy, and not interested in sex. While ED is more common as men grow older, in reality, it can affect men at any age. Erectile dysfunction does not discriminate based on age, which is why we're looking at erectile dysfunction at 20. Below we'll be looking at several reasons. Performance anxiety. As you know, all young men seem to want to give the impression that they're hugely experienced in the bedroom. Because of this, there seem to be increasing amounts of pressure to be able to perform, which ironically can have the opposite effect. Men are just as prone as anxiety to women. It's just that they tend to hide it better for fear of ridicule. When it comes to erectile dysfunction at 20, young men will often suffer from performance anxiety, stress. Another contributing factor to erectile dysfunction at 20 is stress. Many young men suffer stress for a whole variety of different reasons. Some men get stress at college and university, whereas others have money worries or simply work stressful jobs. Stress is a leading cause of erectile dysfunction in young men as it can cause testosterone suppression, it can lower the libido, and it can cause elevated blood pressure. Weight. Another leading cause for erectile dysfunction at 20 is obesity. Obesity is a big problem in the Western world. It can cause heart problems and it can suppress androgenic hormone production. It can reduce circulation, which could also be a leading cause of erectile dysfunction. If you are overweight and are struggling with erectile dysfunction, weight loss could prove very beneficial. Cardiovascular issues. Sticking with the health-related theme we just looked at, if you suffer from heart issues, your sex life could be a problem. Cardiovascular problems could result in poor circulation, damage to the blood vessels, and clogged arteries. When talking about erectile dysfunction at 20, you may not tend to associate heart problems, but the risks are always there. If you aren't getting enough oxygenated blood in your genitals, you won't become aroused and you won't achieve an erection. Excessive alcohol consumption, recreational drug use, poor diet, stress, and obesity can all negatively impact the heart.